First of all, let me thank Michael and his team for giving me the opportunity to present, and as always, pushing the envelope with their software, the functionality, the automation. The evolution of the software has just really been incredible, giving us the functionality to do a variety of different appliances and treatment modalities for our patients. It's an integral part of what we do in our clinical practice and what we teach. As a matter of fact, Michael mentioned our implant continuum, and this is a continuum where doctors from anywhere in the US can come and place implants under our supervision. And we actually spend an entire day in this continuum teaching Blue Sky Plan software. That's the software we use to plan all of the cases. Pretty much all of our cases are guided. We do full arch cases all on X. We 3D print prosthesis while the patients are in the chair. It's really an incredible evolution. And a lot of that has been due to the availability of software like Blue Sky Plan and people like Michael who have constantly pushed the envelope with the functionality of the software. That said, we do have a private practice, Dr. Catherine Ferguson and myself, in near Fort Lauderdale, Florida. And we have all the technology that we need. We have CBCT, desktop scanners, variety of 3D printers, a couple of mills, intraoral scanners. We have 5 intraoral scanners now of different brands and so on, some of which I'll talk about. But the future is now in our clinical practice. We are doing these things on a daily basis. To understand digital dentistry, we have to understand that it's a variety of procedures. We are clinically capturing data. We're doing software design, and then we're doing fabrication. Now, the fabrication part of it can be in the form of 3D printing today or milling. It's rare that we do anything manually today as far as fabrication. So the idea is that we now have software that makes this easy. The clinical capture is still relevant, of course, and I'll walk through some workflows, but the software and the automation that, again, companies like Blue Sky have put into their software has made it so much easier for us to take on this part of it or refer some of this out. We have Lab Pronto, we have other digital labs like Evident Lab, which we use to do our digital smile design. And what we can do is take each of those parts and put them together and output something that we can fabricate. So we're doing our digital designs through Evident Lab, and we send them the scans and they do the digital design in typically in ExaCAD. We can then merge that into our Blue Sky Plan and use that to design the guides and such. So we're starting with the prosthetic end goal in mind. One of the reasons I outsource the design is because I'm not very good at, and I don't enjoy setting teeth up. So send it out to a digital lab, let them do it. And then that's part of your workflow, of course. LD Pankey, talking about workflows, said there are no simple solutions, just intelligent selection. So there's a certain level of complexity that's going to happen as we start to bring in these different data capture modalities. We have to figure out how we're going to incorporate these in the workflow so that we can get into the digital design software and then output from that a product that we can fabricate. Of course, we always start with our clinical exam and diagnosis. Just like you would in an analog world, what we're doing is just a digital version of that. And of course, when it comes to planning the case, software and guide design, that's typically done in Blue Sky Plan, and then we send that to a 3D printer for a surgical guide. For tooth-supported guides, what we're doing is CBCT jaw scan, just a review of all of these, where we basically started with this, which was tooth-supported guides. We're doing a CBCT, that's always the first step. Then we're doing a prosthetic scan if we have a prosthetic outcome, such as a partial denture or denture that is of good function and form and aesthetics. We're aligning that with an optical scan what we call a defined scan, either from an intraoral scan, an impression that we can scan in a CBCT, a stone model that we will scan in a CBCT, align those, plan our implants, draw a curve to create the surgical guide, and print that. For denture-based guides, what's really nice is that in Blue Sky Plan, we have the ability to bring in a denture, scanned in a CBCT, and convert that to what's called a scan appliance. And then that, with one click of a button after your implants are placed, you can create a surgical guide from that, using that as a scan appliance guide, and then 3D print that surgical guide. So that's a denture-based guide. Now, we have different types of case types. This is a classification system that I've come up with as far as case types, depending on what's in the patient's mouth, meaning do they have virgin teeth, or do they have a lot of restoration, such as zirconia or PFMs or gold crowns. So we have case type 1, which is a dentate patient with 5 or more virgin teeth. And basically what we're doing there is aligning the CBCT with an intraoral scan, doing a prosthetic wax up, planning out our implants. If we're doing an all-on-X type bone reduction guide, then we need to do bone segmentation, in which case we're going to design a fixation pin index guide, a bone reduction guide, and then on top of that, typically a stackable drilling guide. And then we'll also design a temporary hybrid if we're planning to do a pickup, although we've moved away from that workflow and we're now actually printing, designing, and finishing the design and printing the hybrid, the temporary hybrid, immediately after we place the implant. So we're actually using the actual implant positions to do that. Case type 2 is a dentate patient with less than five virgin teeth. And in this case, I'm using a scan appliance, which is typically an impression that we use with fiducial markers to scan in the patient's mouth and then scan by itself. The dual denture scan technique, basically, that we would use for a denture, except here we're using it in a patient that has possibility of a lot of X-ray scatter. Now, one of the things that's nice about Blue Sky is that it continues to evolve. So a lot of the case type 2 patients that in the past we had to do a scan appliance, it's incredible to me in the last year or so that Blue Sky has evolved their AI functionality, and with the auto merge function of the STL files to the CBCT, we're finding we need to do this less and less because the software has gotten better. But still, there are some cases that, just because of the X-ray scatter on the CBCT, it's going to be very challenging even for the automated functions to merge these two together. So case type 2 is where you're using a scan appliance, and then the rest of the workflow is pretty much the same. And again, for all on X type bone reduction cases, we're doing a bone segmentation. And that's something that I understand that Blue Sky is working on right now. Hopefully in the next release, we will have the ability for the software to do an automated bone segmentation. We're really looking forward to that, because right now we have to we're typically sending out for the bone segmentations because it is time consuming. And again, it's something I don't enjoy doing. So, we have a service that does that for you, such as Lab Pronto. They can do just that part for you if you want, which is typically what we're doing. We're designing most of our own guides in-house, but the bone segmentation is still a little bit of a challenge. It is time consuming. In some cases, it can take me up to an hour if I sit down and do it. Some cases are easier, depending on the bone density and what's there. But that's something that we have outsourced. And then the case type 2, case type 3 is the edentulous patient. And again, this is the patient that has a denture, and we're using the denture as a scan appliance. Okay. So basically, when a patient comes in, our assistants are the ones that are doing the data acquisition. So this is what we tell our patients: either an IOS plus CBCT, an impression with fiducial markers plus CBCT. And the rule that I use is if they're less than 5 virgin teeth, we're automatically going to that workflow right now. That might change in the future with the automated merging of IOSs, as I talked about. It's gotten better, but we're still using this rule of less than 5 virgin teeth. We're going to go directly to an impression with fiducial markers, a dual scan technique. And then if a patient has a denture, we're going to do a dual scan technique. And then if we feel if we need to do a prosthetic digital design, we'll do a face scan. And of course, later on, after the implants are placed, we will either do a photogrammetry scan or our conventional impression type technique to make sure that we have the implant positions and the alignment of the implants to each other accurate. And of course, if you're doing a analog approach, you want to make sure that you use a verification jig. The interesting thing is that, a lot of folks ask me, is there an alternative to photogrammetry? And photogrammetry is sort of the gold standard right now. You have companies like Nexus IOS, which is another alternative. We don't really have a lot of data on that right now. So what I'm telling folks as of today is, if you're not using photogrammetry, then you should be verifying your implant positions for your all-on-X type cases using a verification jig and using some sort of analog technique. Although, iOS has gotten much better, and I know some folks using just iOS, but there are certain parameters that you have to be careful about. And of course, you have to verify your fit of your appliances. And again, that goes back to using a verification jig. So training and delegation is the key to all of this, because as you can see, we're bringing in all these data sets, which we didn't do in the past. I mean, frankly, when I got involved in doing implants 30 years ago, none of this was even possible. We didn't have the technology. But why are we doing this? We're doing it so that we have better outcomes and that we have more predictability. Okay, that's the bottom line. And of course, we want to make it easy. Digital dentistry is all about aligning scans. Take the case type 1, for example. You're aligning an IOS to a CBCT. Case type 2, you're aligning a DICOM to a CBCT. It's an impression, a DICOM, a CBCT of the impression, but you're aligning it to the CBCT. The dual denture scan technique, you're aligning a DICOM or CBCT of a denture to a CBCT of the jaw. Facial photos to IOS, that's something I'm going to talk about today. Photogrammetry to IOS, because photogrammetry only gives you the implant positions relative to each other. It's not giving you the implant positions relative to the jaw, actually. So you need to still do an intraoral scan to get that and then merge the two. Face scan to IOS and facial photos to IOS, these are things that I'm going to discuss and actually show you how to merge a face scan to an IOS. So all of these different modalities involve new technology, new products, new equipment that you have to purchase if you so choose. And that means more money. Now, does more money mean better outcomes? It does mean more time, though, of course, more time scanning and planning. I actually believe it does lead to better outcomes because it makes things more predictable. But even if the equipment was free, it does mean more time, and time is money. So that's more time scanning and planning. And my good friend for many decades, Jeff Carlson, who I used to teach with, had a saying in his lectures: no lab has ever asked for less information. So the more information you have, the more data you have, the more predictable the outcome can be. So let's look at face scanning. These are the face scanners that we have used in our practice. And I'll go through starting with the RevoPoint Pop 2. We did use the original version of RevoPoint, the Pop 1. Not as good as the second version, so we don't use that anymore. But this is probably the lowest cost face scanner, I think, that you can use for doing any of these types of workflows. It's around $550, and the theoretical resolution is about 0.1 millimeters. And then we have the Einstar, which is a newer machine that came out recently, and we acquired one of these. The difference between the two is, a few $100s. The Einstar is pretty good. I actually think it's a little bit better than the RevoPoint, but I'm still, we're still debating that in some ways. The Einstar is definitely a little bit faster as far as the scanning. So we're really liking that machine. And also we've used the Thunk 3D Archer S scanner, which is basically the scanner that the folks at Instarisa are using. You can buy this directly from several dealers in the US. It's a price point about $8,500. This is a highly accurate scanner. The detail on the scanner is extremely good, but it has one drawback, which I think needs to be mentioned, and we'll look at that a little bit later. But this also is a little bit more clunky to use. You have several wires coming off of it. You have to go through a calibration process, and it's a little bit heavier, of course, than the other machines. But the resulting images are actually quite good. They're actually the highest resolution I've seen of any face scanner or any type of scanner like that. And then a newer machine that's on the market, which I actually don't have, Dr. Reynal Gonzalez, who's literally next door to us, has one of these. It's the RayFace from RayScan, and this is about a $20,000 machine. Very fast scan. The patient sits down in front of it, and it scans them automatically. And we'll see what the result of that scan looks like. So this is, getting some traction in the dental world, and I expect to see more folks acquiring this machine. It is very good, but it comes at, of course, a much higher price point. So let's start off with a case which I actually presented in a previous Blue Sky webinar. This is Dan, 73 years old, and this is how he presented. And one of the first things we did with him was to edentulate the maxilla and give him a set of dentures, which we actually designed in Blue Sky Plan, printed as separate pieces, and then went ahead and used that sort of as a prosthetic goal in mind when we did his all-on-X surgery. Now, I wanted to do it this way because we actually did this case in our implant continuum. We did the upper and the lower on separate days. So the first, we did the upper, and he was able to go home with a prosthesis basically the same day because we are printing our prosthesis. And we used that denture, not the best design. I did do that one myself, but it actually looked like his original teeth were from before, pretty close. He wanted more squared off looking teeth, and that's what we gave him. So we used that design to basically use that design for the the outcome that we tried to achieve in his temporary prosthesis. So we are printing these prostheses in the office and at our course as well. And we did use the Thunk 3D scanner here for getting a face scan and planning out the final prosthetic. And you can see we use this with a two-dimensional photograph, because one of the issues with the Thunk scanner is you're not able to capture the eyes very well. It has trouble with capturing the eyes and also hair. So you're not going to capture the hair, not that you need the patient's hair, but patients with black hair especially, it's hard to capture. And then it has trouble capturing the eyes. So we will overlay a 2D image. Now, a lot of digital smile design right now is being done just with two-dimensional photographs. And the problem with that is really you're only planning in 2 dimensions. So you might be able to match the teeth in the front, but the occlusal plane I find is sometimes off. And when you actually make the prosthesis, the teeth are a little bit short, they're a little bit long. You're not looking at it from different angles like you can with a face scan. But this is the prosthetic we designed for him as the second prosthetic after the first one that was put in at the time of surgery. And this is one we used to refine the aesthetics. And you can see it's much better than the denture that we had first designed. So this case was done in stages at our implant continuum. And then once we got the final prosthetic design 3D printed and the patient accepted it, we went to zirconia on that case. Okay, but that was how we were using the face scan to help with the design of the final prosthetics and being able to look at it from different angles, from above the patient's teeth, below the patient's teeth, et cetera. That really helps us refine the tooth placement, the incisal edges and such. Okay. Here's a different case. This is Angela. Angela presented with a severe class 3 jaw relationship, large overjet. You can see how flared the upper teeth were. So we decided to do all-on-X surgery on the upper, and then we wanted to correct that for her. So we took a face scan again with the Thunk Archer S scanner and merged that into our Blue Sky plan and designed an all-on-X prosthesis for her and surgical guides. And you can actually see in her case, she didn't have a lot of bone. So we actually did some tenting prior to extracting the teeth, so we'd have more bone to work with. And we're able to get 6 implants in. Now, when we were planning out the case, we went ahead and cut out the teeth from the 3D color scan that we got. And one of the things that I was talking to Michael just before the webinar about is that we're having some trouble where our scans are, when we go in to cut out the teeth from the facial scanners, we're losing the color data. So hopefully I can find out why that is, and if it's a problem, we can have that corrected in the software. Or maybe it's the way we're doing the scans. Maybe it's the way we're outputting the scans. I'm not sure. But you can see how in the plan here, we plan on a severe amount of retraction with the temporary prosthesis that we were designing in Blue Sky plan compared to where the teeth were originally. So we're able to merge a face scan with the intraoral scan, which is actually merged to the CBCT image, and then from there plan out the case. So in this case, we had a pin fixation guide. All of this was done, all the planning was done in Blue Sky, and just a very little bit of the finalization of the guides was done in Mesh Mixer, which is basically adding these tubes to the pin tubes. But everything, almost everything, probably 95% of it was done in Blue Sky plan. And here's the bone reduction guide. Here is the stackable drilling guide that goes on top of that after the bone reduction is done. And now we're placing the implants. We always place our implants through the guide to get the maximum accuracy. And then we printed a set of hybrid. I can't remember which printer I used for this, but we had a hybrid that was printed actually ahead of time, and then we did a pickup in the mouth. So the hybrid will typically, if we're doing it this way, which we typically don't anymore because now we're printing after the fact, because we're able to capture the implant positions using either photogrammetry or intraoral scanning techniques. I have a whole course on that, a video course on how to actually create the hybrid directly to multi-unit abutments. But this is the old pickup technique, but we had designed this hybrid. This was designed in Blue Sky plan using the denture module. And we can try that in and then do a pickup from that, close up the case, and then hand that over to my assistant, who then finishes the hybrid, and we're able to deliver that same day for that patient. So the patient goes home with a big improvement from where she started. And one of the things you'll see here is if you go from this image to this image here with the orange teeth to the white teeth, there's a big discrepancy there. It doesn't look as much here because actually the lip support was reduced, so the lip actually came back to where the white teeth are, but it's pretty close to what we wanted as far as the amount of retraction bringing those teeth back. And that's what the post-op x-ray looks like. You can see everything seated properly. Our implants are all in bone, exactly as how we had planned them in the plan, in Blue Sky plan. And we did do the lower on this patient as well, but you can see how, if you scroll through the slices, how the implants were placed. And actually you can see some of the areas that we had bone grafted to be able to put the implants in as well. All right, so a little bit of a challenging case there with the amount of overjet the patient had, but actually that helped, having the face scan to be able to merge and retract those teeth back. So that's what the patient ended up with as far as the first prototype. And from there, we refined that further. We did print that on the frozen printer using the PacDent resin. This is the second prototype we're doing now, using their BL3 resin. This is one of the newer resins out there for doing these types of cases. It's a highly filled ceramic resin. It's actually approved for permanent crown use. And this is a very easy resin to print. And here's my assistant finishing up by adding the pink gum tissue after the print is processed and washed after it comes out of the printer. And then this is what it looks like delivered to the patient. So after the first prototype, this is the second prototype that we're able to design and finish. Now what we did here was I outsourced the design to a digital design lab, got that back, and used that to design this prosthetic, which again this one goes directly to the multi-unit. So in her case, we were in a transition phase where the first prototype, which was done chairside using the pickup technique, had metal cylinders in it. And then the second prototype, we actually designed without those metal cylinders, going directly to the multi-units using the Rosen screws, which were created by Dan Rosen. So we've used a lot of those screws in the last few years so that we can avoid having to use a metal inserts, which complicates things. And then you also either printing or milling. We're printing in a variety of different resins. In this case, with the PacDent resin. But when we mill in zirconia, we're also using the Rosen screw technique and going directly to multi-unit. There are some parameters you have to keep in mind as far as minimum thicknesses and such, but we've had really good success with that as well. So let's look at how we merge these data sets. You can see how having those data sets are helpful, but how do we acquire the data and merge them? So here is my assistant, Jonathan, doing a scan on my other assistant. My poor assistants end up being guinea pigs for these kinds of things from time to time, especially when we're trying to figure out which technology and how to use it. So here is Zulia being scanned by Jonathan. And that was a scan. It was about 37 seconds, I believe, using the Einstar machine to get the face scan. Now we'll take several scans. We will scan with the patient smiling, with a big smile. We'll scan with a retracted smile. And if I'm serious about doing an alignment of an intraoral scanner scan, we will scan with something that comes out of the mouth, but with an impression. You'll see that in a second. That's how you get the most accurate merging of the face scan to the intraoral scan, which is then aligned to the jaw, the CBCT image. So what you see here is the brightly colored image is from the Einstar. And what we have on the other image to the right-hand side is from the Ray scan, the Ray face scanner. So you have a $1,000 scanner and a $20,000 scanner. And what I'm doing here is using Exocad because they have really good best fit matching functionality. So we can compare the two images. So we're using the best fit matching functionality to see how accurate these are compared to each other. Right now, keep in mind, there's always going to be a little bit of a discrepancy because you're scanning soft tissue, and the musculature is going to move the tissue between scans and such. So it's not exactly perfect as far as if we're aligning things together using just the face data. And that's why I'll show you in a minute how we get around that. So pretty good though, the merge was pretty good. And if we look at the cut view, we can actually click and go through basically like slices, and you can see the lines here, the white and the green, the orange and white lines. The white line is from the Ray face scanner, and then the orange line is from the Einstar. You can see they're pretty close. Of course, in some areas they're a little bit different because again, the patient has changed their facial structure a little bit between scans. I will say the teeth data, the teeth detail is extremely good on the Ray face compared to either Einstein or the Revo Point or even the Thunk 3D scanner. the thunk gives a very highly detailed face scan. It has trouble with the teeth sometimes, and sometimes we have to spray OptiSpray on it. So you can get the teeth data. But as I'm going to show you in a few minutes, I don't think you actually need to capture the teeth data that well. There are ways to get around it. And I don't think any scanner is actually really good at that. So here is, for example, the intraoral scan being merged to the ray face scan. So what we're going to do here is use points matching first to do a quick alignment, and then use best fit matching, the functionality that is in Exocad. So you can see it actually didn't do that great of alignment. It actually brought the teeth down too low. And then I actually went back and did a manual alignment by pulling the teeth back up. So the problem with that is that, we're matching points here, right? Just on the front teeth, because that's really all that's visible in the two scans, all right? And to get it done properly, you really need to go further back to get the occlusal plane right. So matching the front teeth might get the cant correct, but to get the occlusal plane right, you kind of need to match in the posterior as well. So this gives you some level of accuracy. And of course, you can go in and manually align it in either Exocad or Blue Sky Plan. And sometimes there's a low minor adjustment that needs to be done based on, what you're seeing. And of course, we have, as humans still have the brains until the AI functionality catches up. So we are the ones that are checking the final alignment, of course. So what we have here is the Einstar scan. We had, before we merged this is the ray face scan here, and then we merged the intraoral scan to that, and then I went back and showed how it looks with the Einstar scan, okay? So how do we get around this issue of aligning teeth to the face scan? So one way is to do something where you put something in the mouth, scan with the face scanner, and that something needs to come through the lips. So we have points that we can merge. And it could be something as simple as just using an impression and attaching a wooden bite stick to it. You could do something a little bit more elaborate, maybe have a cross, 2 bite sticks crossed so that you have more things to match. But this is the basic functionality here of using something that you put in the mouth and scan with the face scanner that you can then also scan with your intraoral scanner and get the teeth positions relative to the face scan. So this is what I'm talking about. The scans you see here were done with the Einstar and the RevoPoint Pop 2. So a $1,000 scanner on the right and a $500 scanner on the left. And the first thing I'm doing is bringing in the face scans, the face scan that was taken with this device, this impression device, put in the mouth. And I'm merging the RevoPoint scan with the Einstar scan. So you can see we were able to merge those fairly well using the facial points. Now, keep in mind, of course, that in one of these, the patient's mouth is open because the impression's inside. The other one, the patient was just smiling. Now, I did cut out the teeth on the Einstar scan, the one without the impression in it. I cut that out in the Einstein software because I know I'm going to be merging that, but I don't need the teeth, and I want the intraoral scan teeth to show through in the very end to get the smile design done. So you should be matching points in the maxilla and above the lip line, because the lip line is going to change between scans and the chin position is going to change between scans. So what I used were points that were above the lip line. You can use the nose, you can use the eyes, and I do like how the RevoPoint and the Einstar actually capture the eyes and the pupils as well. So that's what we're using to help align these two images together. And you can see the RevoPoint looks a little rough on the surface as far as the texture. There are smoothing tools that you can use. And I find that they're really good. They'll smooth out the textures, but you lose some detail when you do that. So, somewhere in between, and you can play with that and figure out what is your personal preference. All right. So now that we have those two aligned, we can now bring in the intraoral scan. We'll actually take that impression and scan it with our Medit scanner, and then bring that and match up the points using the bite stick and the tray and align that properly to the face scan that has the impression in the mouth, right? And now we basically have the teeth position in relation to the face. We can then use those teeth positions and align that to the CBCT, because that's typically how we're doing things anyways. Now, this, of course, is an inverted impression. I mean, it's an impression, so that the image is inverted. So in exocad, you have the functionality of being able to clean up that intraoral scan. It's already aligned, so now we can go ahead and get rid of the impression part and the tray. And it's an inverted image, meaning the triangles are basically upside down. So you can fix that in exocad. You can do this in Blue Sky as well, and I'll show how to do it in Blue Sky. All right, so we clean that up. And then the next step is to reverse the triangles. So we're going to take the entire image using the editing tools, and it's show triangle orientation and then invert the triangle orientation. And now the teeth are in a positive position so that we can then merge in. We can now merge in an actual intraoral scan. So what we merged here was an intraoral scan of an impression, all right? And that's now merged to the face accurately. So now we can bring in an intraoral scan. This is the teeth cutout, right? And now this is the same functionality, by the way, that or the same workflow that we're doing, except now we're doing it in Blue Sky Plan. And I'll show you later, we can actually bring in an actual intraoral scan and merge it in to that impression scan. So the first thing I typically do is align the face scan to our grid lines. And, this is using the denture alignment functionality that you would use for your record bases. But here we're just using the face scan instead of the record base. But we're using this to align to the grid. I mean, you don't have to necessarily do this, but I find it helps, especially later on when we bring other images in, such as CBCT and so on. So this is aligning the face scan to the grid. And then the next step is here, bringing that in, bringing in now the next model, which is going to be here. The same thing we did before that I demonstrated in exocad. We're bringing in the face scan with the impression in the mouth. Okay, you can see they're not aligned to each other. So now we go to the points matching function in Blue Sky Plan. We don't have an automatic matching function here, but I've always found the points matching functionality in Blue Sky Plan to be very good. And I typically will choose, 7 or 8 or 9 points, and the alignments are usually excellent. So here's the Revo point scan. I think both of these actually were done with Revo point. And here is the scan of the impression in the mouth. And we're now going to pick points again above the lip line to match and align these two scans together. So basically, same thing we just did in exocad, we're now showing how to do that in Blue Sky Plan. I didn't speed this video up because I wanted to show exactly how it's done. So I believe we chose 5 or 6 points here. We'll see in a second. And whenever I teach this technique, I always talk about making sure you pick points that are visible in both scans. Not, if you can't see a similar point on one of the scans, don't choose that point. Try to find something else. So I'm moving the scan around a little bit here to try to get some good points. And try to rotate the images so you're looking them from the same perspective as well. That helps tremendously in getting your points matched properly. Now, one thing to keep in mind, you'll see the images are moving slowly. These are very large images, typically. So, you got to have a computer that's fast enough. So we hit the points alignment to finish that. And now we have both images aligned pretty closely in Blue Sky Plan. And we can go ahead and bring in now our intraoral scan of the impression and align that as well. So that's the next step. Here's the impression, just again, like we did before in Exocad. We're now doing the same functionality, again, using the points matching. Remember, this face scan that was done with the impression is now aligned to the face scan with the teeth cut out. We're aligning now using these points, the intraoral scan of the impression to that face scan. So all 3 things will be aligned now. And if you have something like this, which is very well defined, you can even move it around and get a little bit better alignment or pick more points. You could put little divots in the impression material, so it's a little bit more accurate. But what I was doing here was just checking the alignment, see what it looked like, and it actually aligned pretty good. So now we're pretty close to having the occlusal plane and of course the cant as well. So the next step now is to take this intraoral scan and clean it up, the intraoral scan of the impression, clean it up. And by the way, you notice it's just a shell. I didn't scan the opposing side, and there were some holes. We didn't, we kind of do this pretty quickly. We don't need all of the data points. So any holes that are in the scan of the impression, this was done with the intraoral scanner. If you have a desktop scanner, you can do it even faster. But we're going to basically close up all those holes because we're going to invert this model into a positive model using the functionality that the digital pour technique that I defined a few years back in Blue Sky, that we're going to turn this into a positive model. And that's
Ferguson technique.
Yeah, thanks. But yeah, we're going to then invert this into a positive model, right? And now we have everything that we need. Basically, we can do that. Clean this model up as well. And you'll see, Blue Sky arbitrarily chooses a color. So I'll go back and make this white in a second here. And then we can see this image through the cutout. All right. So here's the digital pour. Here is and it's fairly easy to do. We can see the teeth through the cutout image. And because that base of that model was showing, I went back and cut that out as well. And then here we go. So the teeth are now aligned accurately to the face scan. And again, those teeth are, an impression of the patient's actual teeth. Of course, with an impression technique, you're going to lose a little bit of detail compared to an intraoral scan. So we can actually bring in an intraoral scan. Here's the orange model you see there is an actual intraoral scan directly from the mouth. And you can see we have a little bit more detail, right? And if you want that level of detail, you can then just bring in your intraoral scan and merge that as well, and it will now be aligned the same way to the face. And of course, that can all be aligned to your CBCT. And there you go. And because when you take your intraoral scan, you scan the opposing and the bite. Now you can bring in the opposing, and with the automatic functions in Blue Sky, you just automatically align that lower jaw intraoral scan to the upper, and you have the bite relationship. So this is a very accurate alignment, probably the most accurate alignment that you're going to get, because again, matching just the front teeth, even if you have a very detailed face scan, it's going to be a little challenging to get the cant. I mean, you might get the cant close, but the occlusal plane is going to be off. So this is a way to get the entire occlusal plane and the cant and everything. And, you know, if you're planning a case, right, the idea here is that you can do all of this either with a denture or with the patient's existing dentition, or in this case, you know, the patient had teeth, obviously, but whatever is in the mouth, if the patient has a partial denture, you can do the same functionality with a partial denture, just take face scans, impression of the denture, the partial denture, or a full denture. And then that gives you the information you need to get to this stage. And from there, if you need to change the aesthetics on the case, etc., or you can do this after the fact. You know, if you've already done a prototype, let's say on your hybrid, and you want to change something, this is another way to do it, by bringing in the face scan as well. So the idea here is that by doing all of these things, we're going to, you know, of course, increase the predictability of the design from the start. In other words, you know, have that roadmap from before we even start the case, or have it later on if you've already started the case. You know, some people like to do freehand surgery and then, you know, have a denture that they pick up, and then they could do this technique to finalize that final hybrid prosthesis, etc. All right. So out of all the work that we've done with Blue Sky Plan, All on X, you know, designing guides, stackable guides, bringing in face scans, doing digital smile design, all of this gets, you know, somewhat confusing for folks, and it's a lot of things to put together. You know, some folks can go online and learn it all, you know, just from videos on YouTube. And again, thanks to Blue Sky for putting all this educational information out there. But out of all of this work for the last 5 or 6 years, going from simple tooth-supported guides to all the functionality of Blue Sky and software like Exocad, etc., we found, you know, we were getting a lot of requests for a course on All on X. And I realized it's something that if people want an intimate learning experience, we're now able to provide that for them. So we have this course called Ultimate Guided All on X Live Surgery Experience, where we scan, plan, print, place, and deliver. That means we actually bring a patient in. It's a 4-day course. We bring a patient, do all the scans the first day. Then that afternoon, we start planning everything out. We do it ourselves. I show you how to do it all in Blue Sky using face scans, intraoral scans, impression scanning techniques, etc., whatever the case needs, and then design and print the guides the next day. As we don't print the hybrid prostheses, but we do the digital smile design so that we're ready on the third day after the implants are placed. The third day we do the surgery using the guides that we printed the previous day. We'll place the implants, then we'll do a scan either using photogrammetry or intraoral scanning techniques. Typically we'll do both so we can contrast the two. And then we do the design of the hybrid that goes directly to the multi-units. So we actually do the surgery on the third day, scan the implant positions, have the design of the prosthesis partially done, and convert that to direct to multi-unit hybrid prosthesis, which we print and deliver that afternoon, right? And then the fourth day is a wrap-up. It's really just a half a day, wrapping up everything, making sure everybody understands. This is a course I put together really as an intimate learning experience because we limit it to 5 doctors over. This is the first group that we had come through, and we were able to do everything for that patient. And this is the actual patient that we treated. We ran this course, and literally the course, when I started advertising course, within a few hours the course was filled. We ran the first one. We have our second one coming up next week. Actually, that one sold out very quickly, and then the next one we have is in October. So still have a couple of spots left for the October course. But this is really, to me, the crux of the final product, all in one weekend. Basically, this is what the patient looked like. We scanned using the face scanner. And actually here we used a Riva point. I didn't have the Einstar available at the time, or the Rayface, which is next door at Dr. Gonzalez's office, but we could use that as well. But we were able to merge everything using the Riva point, using the techniques I just showed, and design and print stackable guides. Here is the design process, basically. So here, you saw a hybrid prosthesis there. We actually didn't print that. We used that to design the final. But if you wanted to print that and use that for a pickup, that would work. But these are the types of guides we're able to create. And we printed those on our frozen printer with my mini plate. They all worked out perfectly. You can see here, this is the patient biting into the first guide. In this case, we used his partial denture to do a scan appliance guide for our fixation pin guide. Then we went in with a stackable bone reduction guide, and on top of that, use a stackable drilling guide. We did use PRF, so all of this functionality with PRF and everything as far as the surgery itself. And this was the hybrid prosthesis that we had printed as a denture, which we had designed in Blue Sky Plan to get the bite. And we actually used this with an impression technique to capture the implant positions in the vertical, then convert that into an actual hybrid prosthesis. And we use Exocad for this. This functionality is not actually available in Blue Sky Plan right now, hopefully in the future, but we're able to print directly to multi-units using the Rosen screws. Printed that prosthesis in about 30 minutes. And then, our assistant finished it using the pink materials, and the patient was able to go home. This is immediately after we placed it after the surgery. That afternoon, the patient was able to go home with a fixed prosthesis on the lower. So that's where he started. Of course, he still had his upper denture. We're going to do the upper at the next surgery. And here is him. Here is the bite that we're able to get using this technique, right? And the patient was able to go home with this prosthesis. What I like about these printable prostheses is that it's all one piece, and we make them fairly thick so that they're not prone to fracture. But we leave these in for about 5 months. We don't touch these. They leave the day of surgery with a prosthesis like this. And it really helps stabilize the implants and allow them to integrate properly. And this is what, this is our standard modality for doing this now. So we're doing this in our clinical practice. We're also doing this at the clinic where we run our implant continuum. So in our implant continuum this last year, we did 7 arches where the students actually got to do all these procedures, the surgical procedures. And we printed all of the hybrids on our frozen printer with the mini plate, and we didn't lose a single implant. It's really incredible how by putting something in same day that's fixed, that what's nice about these printable prostheses with the Rosen screws, and there are other screws similar to Rosen screws out there, is the hole in the prosthesis is very small. Unlike the ones we were doing to pick up with the metal inserts, those had large holes in the prosthesis. And of course, the metal inserts were bonded in, but it's not as strong as a monolithic structure like this. And if you follow the design parameters and make it thick enough, it's going to last the 5 months. And then, it's really rigidly fixating those implants together. So we're having a lot of success with this technique. Okay. So just a shameless plug here again for digital educators. We have other courses that we give. I mentioned the one where we teach how to design and convert the digital design into a prosthesis, surgical guides, etc. And of course, the one with designing the prosthesis itself. That one we use Exocad for until hopefully Michael's listening, and we'll try to add some of that functionality in the future in Blue Sky Plan. It would be nice to be able to do everything in Blue Sky, but we're able to do about 95% of everything we need in Blue Sky. And again, I want to thank Michael and his team for really pushing the envelope with Blue Sky Plan over the years. And, it's still our go-to software. So thank you, Michael. And with that, I will leave you with my contact information and turn it back over to Michael. I'll answer any questions.
Okay, great. Yeah, if anybody has any questions, I think we have time for a few questions. You could just enter into the Q&A chat box that's on your screen. Rick, there's discussions on different groups about the face scans being done with cell phones and cell phone apps. Have you had any experience with that?
So I did use some cell phone apps early on. And here's the thing, I don't believe they are going to be as accurate. Will they work for certain cases? Sure, it depends on what level of accuracy you're looking for. If you notice all of these face scanners that I showed, they have several lenses and they're far apart, which you're not going to necessarily get with a cell phone. Even so, those cell phone cameras now will have typically multiple cameras in them. They're closer together, and you need that triangulation to get the accuracy as far as the dimensional accuracy to match up with the face. How important that is, I don't know. I know, for orthodontic uses, I know you guys are exploring those types of techniques, but I just haven't, I honestly don't have an answer for you as far as how accurate those are. Maybe in the future we'll look at some of those. All right. I like to have, one of the reasons I like the lower cost scanners like the RevoPoint and Einstar is because they're actually affordable enough that we can have one in every operatory, right? And that's how we work. We have intraoral scanners in every operatory. It's just so much more efficient to not have to drag things back and forth, et cetera. So my assistant, Jonathan, who started with us about 6 months ago, he's really good with technology. Of course, he's a young kid, so he's the one that I basically, if I buy a technology product now, I just hand it to him and say, hey, go figure out how to install all the software and everything. And he's been really an asset for us. So find somebody like that. And, that's again why I like some of these low cost options, not just the price point, the functionality has to be there.
Okay, I was actually going to comment, Rayface, I think, is finishing a direct bridge from their software to Blue Sky Plan.
Awesome. Yeah.
And I think they also have advanced functionality in terms of merging everything together. So you get the CT, the face scan, the models, everything merged in their software, and then transferred as a unit to Blue Sky Plan.
I love that they're doing that with a third party like Blue Sky, because I know Carestream has that on their 9600 machine, but it only works within their system, within their ecosystem. Good.
Yeah. Yep. Okay, so just a few, to reiterate a few points I mentioned at the beginning, you could visit our schedule of upcoming presentations as well as past recording presentations on blueskybio.university/webinars. Blueskybio.university is also a great asset. It's where we're centralizing all the educational information regarding all Blue Sky Bio products, physical and digital products. So if you haven't yet checked it out, you could go ahead and do so. Upcoming course information, online, offline, a lot of tutorials, and just everything connected to education is centralized at blueskybio.university. We'll be sending out the seed credits for today's presentation, usually within around a week or so via email. And Rick, I'd like to thank you for everything that you're doing for dentistry, digital dentistry, education. It's incredible. Today's presentation was incredible. And anybody that's interested in additional education, definitely check out the websites, the online courses, the face-to-face courses, and there's a tremendous amount that could be learned, obviously.
Very good. Thanks again, Michael.
Thank you, and thank you everybody for attending today's presentation. We hope to see you at future presentations as well. Take care. Have a good day.